Hey, good morning. Good afternoon. What is it? 12:01. So it's afternoon, I guess. So I very quickly want to share with you today the census at the shelter is 143 women and children. Numbers are continue to increase, move up after the pandemic. So not a good picture. I also want to share with all of you that we are preparing for April, um, Child Abuse Awareness Month. And we will be having some interesting conversations at the state level related to the intersection of domestic violence and child abuse. As you know, and maybe have heard me say in the past repeatedly, that domestic violence and child abuse coexist. This comes on the heels of some very disturbing cases and recent cases in our city. So I will be sharing some of that with you in the near future. And also, I want to bring the voice of Kathy Fletcher, ED of Voices for Children. She wanted me to share with the task force that there was a very successful presentation that Patricia Castillo, myself, and Judge Rosie Gonzalez had last week in Spanish. So she just wanted me to say that. So with that, that's all what I have to say. So Julia, if you want to take it away and introduce Judge Diaz.
Let me just say one thing, Julia. Marta,
Yes,
I
absolutely.
already and Judge Speedlin is not joining us because she's on a panel at 12 noon with some folks from LA or something.
Right. That's Senator
Join us
Jose
today.
Menendez. Yes.
And also the other thing is that I got a message from the Mexican consulate, and they want to know when we're going to do our next Spanish domestic violence and child abuse presentation, because they would have liked to have participated, and so
We'll be ready.
we're ready. We already know what to do.
Exactly.
Julia.
All right, Judge Diaz, are you on? I actually can't see if she is.
Yes, I just got on a minute ago.
Oh, good. Okay. Well, welcome. So then you don't really need an introduction, I think, to this group, but I will just let everyone know that today we're going to cover our 2-year report for what the commission has done, this committee as well as all of the others. So, Judge, do you want to talk about that for a minute?
Yes, thank you so much for the opportunity, everyone. Good afternoon. Can y'all hear me okay?
Yes,
ma'am.
Okay, great. So as Julia stated, my name is Monique Diaz. I'm one of your civil district court judges. I preside over the 150th District Court, but I also proudly represent the county in the CCDV, the Collaborative Commission on Domestic Violence. So I'm just going to get us started with a little bit of background before we dive into presenting. We have several of our committee chairs here ready to present to you all on our Year 2 report that was recently released. So for those of you that do not know, the Collaborative Commission on Domestic Violence was created in 2019. You all, I'm sure, are aware that in 2019, we received statistics for 2018 indicating that Bexar County had the highest rate of domestic violence homicides committed by a man against a woman in all of Texas. When that alarming statistic came out, there was obviously a call to action from our community, which we saw very clearly. Many of you were present at the town hall that was hosted by Congressman Doggett and Congressman Castro, along with the chairs of this committee, on the issue of domestic violence. At that town hall, we spent hours literally listening to survivors, families of victims, sharing their stories, talking about the issues. There was a lot of momentum around finding solutions to this epidemic. So as a result of that, then City Councilwoman Shirley Gonzalez and now City Councilman Manny Pelaez teamed up to request that the city conduct a comprehensive assessment of our community's response to domestic violence in furtherance of putting together for the city a 5-year plan on how they were going to address this issue. So from that assessment came the Love Is Comprehensive Domestic Violence Plan. You can find it on the City of San Antonio website. We also have it on the CCDV website. And what that assessment did was it conducted surveys of many providers, including yourselves, surveys of victims, surveys of families of victims, along with looking at some of the data from the entities that had that available to identify where are the gaps in our community's response to domestic violence, and identified those gaps and then matched them up, each gap, with 2 or 3 evidence-based strategies that have been proven to reduce domestic violence, to improve responses to domestic violence in other communities. So while that report was being done, then Judge Peter Sakai, he's unfortunately retired now, we miss him, but Judge Peter Sakai was having some conversations with City Manager Eric Walsh about how the city and county could work together to execute the plan that was developed by Metro Health in that Love Is comprehensive plan, because we know that this effort to reduce domestic violence requires the entire village. And we also know that historically we have really operated in silos in addressing domestic violence. Now, this task force has done a great job of bringing together folks from all of those different silos for a very long time. But what we saw was a need to really bring everyone to the table that has the ability to impact policies and procedures within their own silos, right? So taking all of your input and making a difference within those their respective entities. So they created, Judge Sakai and Eric Walsh decided to form the CCDV. Judge Sakai officially formed the CCDV through a special court order that established the organization. So there's actually an order filed. The CCDV is comprised of 6 different committees. So again, these are the former kind of silos that we know we're working on domestic violence. We have a prosecution committee that is co-chaired by our district attorney, Joe Gonzalez, along with city attorney, Joe Nino, and he'll be presenting today on their portion of the 2-year report. We have a judiciary committee that is co-chaired by Civil District Court Judge, the Honorable Mary Lou Alvarez, who is in that Senate meeting today and unfortunately cannot join us, and Criminal District Court Judge Ron Ronhell. We have a nonprofit committee that is also you all. Your DV task force is actually also, all of you are part of the CCDV. So if you didn't know it, now you know. You are all part of the nonprofit committee of the CCDV. And that is tri-chaired by Patricia Castillo, Marta Pelaez, and Julia Rainey Rodriguez. Bear with me, I'm halfway done with the committees. We also have a law enforcement committee that is co-chaired by our Chief McManus and Sheriff Javier Salazar. We have, and here we go. Hi, Chief. I see you're with us. Thank you for joining us. We also have a healthcare committee co-chaired by UHS CEO George Hernandez and Center for Healthcare Services CEO, I believe is her title, Jalynn Burley. And lastly, but not least, we also have an education committee, and that is co-chaired by Dr. Cynthia Teniente Matson with A&M and Mike Flores, the Chancellor of ACCD. So these are the 6 areas that we identified that have an ability to influence policies and procedures regarding our response to domestic violence, because all of us see every one of us in whatever your profession is, whether you know it or not, you're going to come across victims of domestic violence. But these are the areas where we identified we could have the greatest impact. Each one of those committees is cross-pollinated by representatives of the other committees. So again, trying to break down those silos so that we are really talking with each other about what our issues are, what our concerns are, and how we can address them. The CCDV meets as a whole, all of those chairs quarterly, but each of the committees meet at least once a month, some of them more often than that. And each of the committees went to that Love Is plan. The very first task that we had was to go to the Metro Health's comprehensive assessment, the Love Is plan. And each committee identified 1 or 2 gaps and 1 or 2 strategies, evidence-based strategies to address those gaps that they wanted to take on in year 1 of their work. And then we also did the same thing for year 2, and we are now in year 3 of our work. So that leads us to our presentation today. We have released reports. We have our first year report. It's available on ccdv.org, also on the City of San Antonio website, that talks about our first year of work. But we recently released our year 2 report. So we're here today to present to you all our accomplishments, our challenges in the second year of the CCDV's work, and also to briefly discuss the strategies that all the committees have chosen to take on in the 3rd year of our work. And importantly, we're also here to answer questions, to get your feedback. So we want this to, while we're presenting to you, we want you to also feel welcome to interrupt at any time, ask questions, ask for clarifications. That's what we're here for, is to explain and provide information. So thank you for your patience with that long-winded introduction. I'm going to ask our county CCDV liaison, Noah Fuentes, to please pull up our PowerPoint so we can begin with the presentations, please. And while he's doing that, anybody have questions about what I just said? Okay. All right. Thank you, Noah. If we could go to the next slide, please. Next. Okay. So up first, we have our presentation for the Healthcare Committee. If you could go back 1 slide, please. Wonderful. All right, and I believe we have a representative from the Healthcare Committee present to take this on.
Yeah. Good afternoon, Judge. Thank you. My name is Andrew Smith. I'm the Executive Director of Government Relations and Public Policy for University Health. And on behalf of George Hernandez, our CEO, and Jillian Jackson, I'm happy to be here to represent them and give this report to the committee. I have kind of a written report that was provided to me, so I'll work from that as well as the PowerPoint.
It's for Crystal. It's a number 1, just the chicken sandwich and the French fries in a water, not a bottle of water. Just a water, no sauce, please.
Could you all please stay on mute? I don't know if the host is able to mute folks. If so, we would appreciate that. Sorry, go ahead.
Making us hungry.
Lunch is important. So just a brief kind of summary of the accomplishments or the goals that were set out and obtained or achieved in the 3rd year, 2021. The Health Committee efforts during the year focused on developing a plan to streamline the process to connect victims of domestic violence with resources in real time for safety, shelter, and other services. To that end, a partnership with the Southwest Texas Regional Advisory Council, or STRAC, with funding provided by University Health, started a domestic violence referral hotline, which was piloted with the Bexar County Sheriff's Office, which allowed officers responding to domestic violence calls to use the hotline to connect victims and their children to safety and resources. Going forward, the plan is to extend the hotline to physicians and other healthcare professionals when they have a concern that their patients may be victims of domestic violence. University Health also provided funding for the Family Violence Prevention Services to include the Battered Women's Shelter and the Children's Shelter to support options for safety and trauma-informed services for families. The second initiative revolved around public service campaigns. And the first campaign, we're working with major stakeholders, launched a month-long Purple Porch SA campaign for the first time in San Antonio to raise awareness of domestic violence. We also took the message to social media with the Love Is campaign that the judge mentioned already, specifically addressing women with examples of what love is not and how to get confidential help online or through a local hotline number. Additionally, bilingual fact sheets were created to help women learn more about the risk of partner violence during pregnancy and how that may impact their pregnancies and then the birth and then the early stages of their newborn infants or babies. Some of the goals for 2022 for the upcoming year are working on a number of projects to roll up into our accomplishments from the previous year. We'd like to engage more OBGYN and family practice physicians. These physicians are kind of on the front line of seeing, they are on the front lines, and these physicians care for pregnant women and breastfeeding moms. In this effort, and are a first line of defense, 3 in 10 women experience some form of abuse, and pregnancy poses a risk. Between 4 and 8% of women experience domestic violence during their pregnancy. The effects of violence during pregnancy can be devastating to both the mother and the unborn child. Domestic violence during pregnancy is linked to depression, drug and alcohol use, smoking, first and second trimester bleeding, and a reduction in birth weight. Even more sobering, murder is the second most common cause of injury-related death for pregnant women behind motor vehicle accidents. We hope to encourage increased screening for domestic violence by offering resources to physicians when this deadly risk is detected. Through the Bexar County Medical Society, the committee is working to provide domestic violence education to local physicians, and we appreciate this morning's opportunity, or this afternoon's opportunity, to reach out to local doctors, midwives, maternity nurses, and others involved in the care of pregnant women in our community. If any other healthcare providers are interested in learning more or helping in this education initiative, we encourage them to reach out to our liaisons here at University Health who've been working with the committee. And our second goal for the year would be to continue with the public service campaigns, to develop another campaign to reach more women directly, and to build upon the foundation created through the Love Is campaign, and really try to ramp that up during the Domestic Violence Awareness Month in October. And we're looking for major media partners in this life-saving effort, and hope all area TV, radio, and print outlets will say yes when we reach out and ask for support. That's my report, Judge, for the Healthcare Committee. I'm happy to try to answer any questions.
Thank you so much, Mr. Smith. Does anybody have questions about the Healthcare Committee's accomplishments and year 3 goals or comments?
I have a question. So is it all the OBGYNs at university that are being trained, or how does that work?
Yeah, I think we would like to take it outside the walls of University Health and really engage the community. I think that's why we're trying to form the partnership with the Bexar County Medical Society as well, to reach as many physicians in the community as possible.
Okay.
Judge, I had a question. Well, I'm sorry, it may put you on the spot, but I know that Judge Wolf had announced with University Health about developing this public health component on there. And is that going to have an impact with domestic violence or trauma or any of those things? Or how do you see that evolving?
Yeah, so the great question, and appreciate the question. The Public Health Division is, a lot of that, the goals and mission of that are still kind of being worked out. A lot of the focus will be on population health, social determinants of health. And so, within those parameters, I believe domestic violence certainly would fall within that. I mean, social determinants of health are those conditions in which we all live in, economic health, food insecurity, things like that. Many of these are drivers that can lead to violence or domestic violence within the community. So as we look at all of those conditions within our community, I believe they could all certainly dovetail within the work that this committee is doing, this task force is doing. But a lot of work to be done there.
Great questions. Thank you, both Sandra and Mike. Does anyone else have questions? Okay, thank you so much for coming to present on behalf of the Healthcare Committee. That was very helpful. Let me take a moment to pause, and I failed to state this at the beginning. I'm sorry. My wonderful co-chair, Deputy City Manager Maria Villagomez, should be joining us soon. She is finishing up executive session with council right now, and so she'll be joining us as soon as she's done. But I did want to make sure you all know that she's on the way and regrets not being able to be here at 12. Okay. Let's go ahead and go on to the next slide, please, Noah, for the next presentation. And I think we were going to switch these around for the Judiciary Committee. Could you scroll to the next committee, please? So it's a bit longer of a presentation. So just as so you all are aware, what we decided to do was break up our presentation a little bit. We're not sure if we would have enough time to present on every committee today. So we're respectfully requesting, if you all are open to it, for us to come back to present on law enforcement, because we also want to be sure Maria is here to be a part of that conversation. So we're going to hold off on that part of the presentation, and hopefully, if you all will allow it, we'll come back and present on both law enforcement and the education committee. So we're going to cover the other 4 today. So next slide, please. Okay, so nonprofit committee is up next. So if I could have any of the tri-chairs who wishes to present on the nonprofit's work, you may proceed.
Okay, if I may go first. Julia, Patricia?
Yes.
Unless each one of you want to? No? Okay. Okay, so for the general concept of the goals of the nonprofit committee, we have left the goals untouched as they are ongoing and moving forward into the 3rd year. FVPS has committed to participate in education in the community, namely to the healthcare system. We have provided and will continue to provide education in the local medical school to medical students. And to that effort, we will continue to advance our advocacy alongside the Texas Council on Family Violence before the medical schools in the state to make sure that education on domestic violence is included in the curricula of the medical schools. We are accessing locally, we are accessing all years of study in the local medical school and having wonderful responses and a lot of interest on the part of the students and the physicians, professors who are leading those efforts. So I also participate, as Judge Diaz said, in collaboration with other committees of the commission to make sure that we can provide input and or learn from whatever is happening on any of the other committees. So that's what FVPS will continue to do, and working alongside with like I said, all of the other committees to make sure that our work is not disconnected from each other, and advance our efforts in a more efficient way. Patricia or Julia?
Sure, I can talk about the pro bono efforts that we've done. One of the issues that we identified as a very diverse and large committee was the lack of pro bono assistance for family violence survivors in our community. And so we worked on that in year 1, we worked on that in year 2, and we will continue to work on that in year 3. Getting pro bono attorneys during COVID was a challenge. To say the least, and training them was a challenge, and yet we were able to provide training to a fairly large group of attorneys and assign cases to a smaller number of attorneys. We trained 97, 17 provided support. We are going to continue this effort in our 3rd year because this is kind of a 2-pronged approach to raising awareness and addressing family violence in our community. One of them is legal aid attorneys and prosecutors shouldn't be the only attorneys trained on family violence and the dynamics of family violence. It should be everybody who practices family law. And so our goal for these trainings is to train family law attorneys how to work with domestic violence cases in the courts, the dynamics of domestic violence, and the importance of addressing it in their family law cases, because for as many survivors that I see at Legal Aid or that Marta sees at the shelter, that Patricia works with, there are many other in the community that hire attorneys and go into court, and they need to be as prepared as the rest of us. So we're continuing our efforts. If you are an attorney or know an attorney who practices family law and would like to assist us, please let us know. We are going to be doing another training soon. So that's our update. Patricia, do you have anything to add?
I would like to add that we are in the process of training the faith community as well. I've just done 6 out of 10 planned training sessions with members of the faith community. We have on average about 20 members of the faith community that attend those trainings. And so we'll finish those 10 and see where that takes us. I've also already been invited by one of the groups to come and help them implement something within their congregation. And so that's another very important, very large group of people in our community that are in a position to really make an impact with regard to their congregations. And so I'm really glad that we're doing that. And then my classes on teen dating violence and domestic violence for both teenagers in middle schools and high schools are ongoing, as well as doing those kind of sessions for parent groups from the schools, as well as PTA groups from the schools. So that's something that continues. I know that, this whole thing with the governor and their stance on educating, was something that was going on over there on the side, but we just keep doing what we know we got to do and keep working on all of that. So we'll continue to keep doing that and build on it and try to get into as many, schools and parent groups as possible to inform and educate about this issue, because it's huge. And teachers and counselors and communities and schools personnel and social workers on campuses, all of them recognize the tremendous need with regard to this issue. They see the impact of it.
So, Patricia, if I may add, I have been visiting with superintendents of the different district to bring to them the need to implement domestic violence programs, or at the very least to bring the very basics of domestic violence and teen dating violence to their schools. Curricula has already been selected, science-based works that have the recommendation of the Center for Disease Control and have been blessed at the state level. So those are the conversations that are ongoing and part of our goals.
And I'm going to add one other thing, and then we will give our time over to the other committees. But one thing that's not in this report, but I think that's important to talk about also, is Legal Aid was given a grant by the county to expand our capacity to assist survivors of domestic violence in Bexar County specifically. And so that is another thing that we are working on. It's tangentially related and as a result of some of the work that this committee has done. And so we're grateful to have that funding for 2 additional family law attorneys to help survivors of domestic violence with family law issues. So despite the pandemic, we've been doing a lot of work through this committee.
Yes, and if I could just follow on that real quick, I'm so sorry. We do have that addressed in the Judiciary Committee's work. You all may recall the Judiciary Committee took on the strategy. One of the strategies was expanding legal services to families beyond just protective orders, basically. So it was a collaboration between the Nonprofit Committee and the Judiciary Committee. So I'll briefly touch on that later, but I was going to call on you then. So that was perfect. You've addressed it already. I'm sorry to interrupt, Patricia.
Just wanted to add, I forgot, we are also doing at least 5 or 6 classes, parenting classes with regard to domestic violence and parenting education training using the PPP Positive Parenting Program curriculum. That's ongoing. We're now receiving referrals from the Child Protective Services system to provide those classes to those families as well. And so that's growing by leaps and bounds, believe me. So I forgot to add that piece as well. Thank you.
Thank you all to our wonderful tri-chairs. If you'll see on the screen, we have summarized for you, for everyone in the room, what the goals are for year 3 that were addressed. I do want to take a moment in the chat. I was not monitoring it earlier, I'm sorry. There was some great feedback. We heard from Linda Wilson that Rena Castro through Justice for Aaron is also working on training teens in schools. So I'm sure y'all are aware, but that's good to know, and perhaps there's some collaboration there that can be accomplished. And Linda Wilson also mentioned that Rena and others succeeded in getting clear alerts passed through the ledge, notifying if an adult has been kidnapped. So we're so excited about that development too. And just going back, there was a question about the Love Is campaign and whether that's doing something around Mother's Day. So I wanted to see if possible, if William, if you could maybe address that question.
I can check. I don't know if there are plans to do anything around Mother's Day, but I can certainly bring that question back.
Thank you so much, William.
Of course.
All right. Does anyone else have questions for our nonprofit/DV task force tri-chairs?
Yes. Good afternoon. This is Benny Price from Big Mama Safe House. And I did have a question. Did y'all have in mind the small organizations that that are kind of like buffering domestic violence victims and ushering them into the big organizations that have all the resources?
So if I can try to answer that question. The goal of the CCDV and the nonprofit committee kind of serving the dual role with the DV task force and the nonprofit committee is that we really wanted to be sure that that those types of organizations, that everyone that is working on DV that we see has been a part of this task force, that all of those voices are being heard, that your input is being considered and processed. So we really wanted to make sure that we allowed the space for that to happen through this dual role with the DV task force. So to your specific question about kind of utilizing the resources of bigger organizations or maybe better funded organizations, I think that's a great issue and a topic for discussion. It's not a specific strategy that we have identified to take on right now that ties to gaps that were identified in the Love Is plan. And we really try to, there's so much great work happening around domestic violence, and this presentation you just heard is an example of that, right? It's not just what the CCDV strategies say we're doing, but all of the other work that we're collaborating on. So I would suggest that maybe that's something that a point of conversation that can be considered through this committee, but may not be necessarily one of the strict strategies, because we try to stick to the Love Is plan and go off of that research and those evidence-based strategies. But it's something that we should talk about and consider. I hope I'm not overstepping. If the tri-chairs want to add or clarify anything to that.
No, absolutely not, Judge. So we, and I'm speaking for Family Violence Prevention Services, we're ready to have whatever conversation is deemed necessary with whoever, as you said, Judge, is working on domestic violence. Please reach out to me. I don't know if this is the time to offer my phone number, but www.fvps.org. Let's have a conversation around this. I'm sure that Patricia and Julia would also want to participate in those to expand the understanding that needs to be had around other organizations who are also working to alleviate the problem of domestic violence in our community.
Thank you, Marta. Great question. Any other questions for the tri-chairs? Okay, then I believe we have up next our prosecution committee update. And I think DA Gonzalez, if I'm not mistaken, that you all have your own slides to present. Is that correct?
That is correct.
Okay.
Lauren Coronado from our office is here. Lauren, could you hold off on the slides for just a minute? Yeah, okay. Let me go ahead and start. I want to obviously be mindful of everyone's time, but I want to make sure and get in everything I want to present within the time that I have allotted. But let me just begin by saying that I feel good about what we've done so far, and I feel even better about where we're heading in the future. But I'll tell you that I want to, first of all, let me tell you that I want to cover both what was covered in year 2 and then talk about year 3. What I hear a lot of people saying so far today is the overriding component is education. And that's certainly the case with prosecution. We identified 2 components during year 2. One was educating the public about the scourge of domestic violence. Again, we all know that because we're subject matter experts in this area. But does the average citizen know? Is the average citizen aware of how bad that problem is in Bexar County? Unless you're a perpetrator or a victim or related to a victim, you may not understand the level and severity. So I think educating the public is very important, and that's certainly something that we focused on. Myself and several members of our administration went out into the public to meet with community-based groups, homeowners association, colleges. I remember even going into the high schools to educate, our high school kids about no means no, and so that's certainly something that's very important. But also along with that is educating our leaders about the solutions that are needed. And I'll tell you that one of the biggest successes that we saw this past year was the leaders in the judiciary collaborating with members of the Commissioners Court. And obviously I'm talking about on the county side, that they came together and they recognized the need to provide funding. And as a result of that, as a result of more of the county court judges agreeing to handle family violence cases, as a result of the commissioner's court all voting for additional funding, we now have 4 dedicated county court courts that are handling domestic violence cases full time. Not only I see Judge De Leon here, but not only his court, Judge Gonzalez, but also County Court 8 and 11. That's Judges Roman and Stohansky, in addition to the other county courts. So that's going to make a big dent in resolving some of these quick cases in the future. We already started with jury trials this week, so hopefully we'll see a significant dent in the backlog. But in addition to identifying education as a component, what can we do in the DA's office internally? One of the things that has made, I think, a significant improvement, and I see Melly Powers from our office here, is creating an internal work group where they are meeting on a regular basis. I noticed they were meeting outside my office yesterday. They meet and discuss cases so that we can handle them more efficiently. Part of the goal is to reach out to domestic violence victims as soon as possible. Another part of the goal is to reach a decision as soon as possible so we can bring them a resolution. So that's the kind of efforts that we've been making in this past year. And of course, like everybody else, COVID has impacted us going out in the community, but we've done everything. We're continuing to work to the end of educating the public and trying to improve how we handle our cases internally. On year 3, with the time I have left, let me tell you that we've identified one of the most important aspects of what we do over here is providing protective orders. Crystal Chandler, and I'm not sure if she's on today. I don't see her on my screen, but her and her team have done an incredible job in identifying high-risk situations where victims have an immediate need because they're in a dangerous and volatile situation. We can start the protective order process. And okay, Lauren, if you want to bring the slides forward, we can't start the protective order process until we serve the respondents. What we've seen in the past is respondents avoid us, right? We go to serve them and they disappear and we can't find them. So our investigators are having to work around the clock. Part of what they do is they encounter people that don't want to be served, people that may be involved in the criminal element side. There have been numerous times when our investigators have encountered people that have weapons, that are armed when they answer the door. I know recently we had a situation where we had to serve a sicario, an assassin, and that was certainly a dangerous situation. Because we went to Commissioner's Court and asked them for additional funding, we recently got funding for 2 other additional investigators to serve these high-risk protective orders. As you can see from the information on the left side, it doesn't begin until we serve the respondents. Because of the initial investigators, we're going to be able to hopefully more efficiently handle service, more efficiently handle these protective orders, and bring and do this in a safer manner and bring resolution to the victims of domestic violence more rapidly. So that's pretty much all I intended to present. You can see here's our indicators. Our goal is to serve at least 65 protective orders, and we're going to be monitoring them every quarter to make sure, again, we do it efficiently and as safely as possible. Okay.
Thank you, DA Gonzalez. We really appreciate that presentation. Before I call for questions, I just wanted to take a moment to acknowledge that our co-chair, Maria Villagomez, has joined us. Thank you for being here. And she'll present some remarks at the end of the presentation. Does anyone have questions for DA Gonzalez about his presentation on the prosecution committee's accomplishments and goals for year 3? Okay, well, thank you for that presentation to DA Gonzalez and Lauren. We appreciate you as well. If I could ask for clarification from the tri-chairs, does this meeting end at 1? I believe it does, right? Okay, So what, if I may suggest, do we have permission to come back for the remaining committee presentations next meeting or whenever you deem is appropriate for you all? Yes.
Absolutely. Yes.
Okay, great. So we would love to do that then, because obviously it's a lot of information, and we'll come back and present on again the law enforcement committee, the education committee, and I'll reserve the judiciary committee presentation for the next meeting as well. It's a bit lengthy, goes into some detail about the firearm transfer process that's been developed and all of the forms, kind of walking through and explaining those to you all. So we'll do that at the next meeting. We really appreciate you all. Maria, do you have anything you'd like to say?
Thank you, Judge. And hello, everyone. I'm Maria Villagomez. I apologize. I came in late. We had our City Council business agenda meeting today, and that's the reason why I was a little late. But thank you for the updates, and I was able to listen to the DA's update, which I think is very impressive in terms of the goals for this third year, and looking forward to continuing to working with all of you. So thank you.
Thank you, Maria. Well, that concludes our presentation for today. Does anyone have any other questions for us? Okay, well, thank you for the opportunity.
Wait, Monique, I want to ask the group something.
Okay.
Listen, I was contacted last night about a group that has a big donation of new Amazon clothing, their clothing that has been returned, and they're not going to, like restock it. And I was wondering if there was any group that is in need of new clothing to provide for clients. And if so, can you please contact me so I can put you in contact with this group that apparently has a big donation from Amazon of brand new clothing that's not going to be restocked. Okay? Okay, Casa, you got it, Linda. Anybody else? Everybody knows how to get a hold of me.
Can I ask one
question?
Comment? I do.
Go ahead.
And I know we're closing this meeting, but I want us to think about this. I'm still very, very concerned. It comes up in our open meetings when we're talking. This link between child safety and violence. I really think this committee needs to set up a committee that is going to deal with that.
Speak up, Linda. Can't hear you.
Oh, you can't hear me?
No, speak up.
Coming in choppy, Linda.
Oh, I'm sorry. I don't know what to do about that.
Just speak up. That's okay. Go ahead.
As loud as I can.
Okay.
I just think that this committee needs, the big committee, needs to have a subcommittee dealing with domestic violence impact on kids. And I just want people to think about that for the future. We talk about it a lot, but we haven't linked it within the framework of this larger committee. So I just want to put that out there. Could you hear me now?
Yes, yes. Yeah, that they came in loudly and clearly. And that is precisely what I said at the beginning, we're working on. You're very right, Linda. Domestic violence and child abuse coexist. And we need to move within this committee to apply that concept to moving it forward as a group. So wonderful idea, taking note, and we will get back to you on that.
Yeah, add something to that briefly. It's a great point, Linda. Thank you for saying that. I do want to note that the CCDV was instrumental in supporting a successful request from Commissioner's Court to create a new CPS court with a concentration in domestic violence. So that intersectionality between child welfare cases and domestic violence here in Bexar County 30% of our CPS cases have domestic violence as the primary reason for removal. 60% of all of our CPS cases have domestic violence as a primary or a secondary reason for removal. So what we did is the civil courts collaborated with the CCDV. They advocated for that request and it was granted. We just hired our new judge for that third CPS court. His name is Judge Raul Perales. He came from DA Gonzalez's office. And we're sorry for him, but really grateful for us. So we acknowledge that, but there's certainly more conversation that needs to happen. I just wanted you to know some progress is being made on that end here in our community.
I would also like to say one more thing, Judge, that it was suggested that maybe it's time to have another town hall meeting to update the community in terms of our, 3-year progress of work in this area. So if anybody is interested in working on something like that, please get in touch with me because maybe it's time for a little update since that first town hall happened and how things are going and what it is we can do. So if there's interest around that, be in touch, please. Thank you. I don't know why I'm always making work for myself.
Well, as far as on our end, there was a question if our PowerPoint would be circulated. We'll go ahead and email that to you all as well. You can learn more about the CCDV at ccdv.org. We also encourage that you all follow all of our social media handles. We're on Facebook, Twitter, and Instagram. And you can find us at Domestic Violence Commission or DV Commission. Those are the two handles. So we welcome your feedback on all of that. You can learn more. And if anyone has questions and you want to reach out to me directly, I'll also put my email address and cell phone in the chat. I prefer text messages. If you can, send me a text if you want to get in touch. I'm happy to visit anytime. And
It's froze. Hey, Susie, I wanted to ask you, how do people access the recordings of these meetings on the CCDV website? Somebody said they were looking and they couldn't find them.
It's under trainings.
Okay.
If you hover over professionals, I believe.
Uh-huh.
I'm pulling it up right now.
Okay.
Yeah. So under for professionals, you go to trainings. There's an arrow, and then there's Domestic Violence Task Force Library.
Okay.
Click there, and it has all the recordings starting in August of last year through last month, and obviously we'll add the one for today.
Excellent. Excellent. Yeah, there's lots to learn, because people share very good, very educational, very helpful information in our meetings. And so I'm so glad that we're, maintaining that library so people can access it at any time. But thank you so much.
And I'm putting the link right now in the chat.
Oh, excellent, Susie. I really appreciate that. We lost you, Judge. What happened? You got kicked out?
I did. I don't know what happened. I'm sorry. I'm back.
Okay. Así pasa. Thank you, Rosemary, for putting that up about the ACEs training. Very important.
You're welcome.
If people haven't been to ACEs training, please get there because that's vital information for the work that we do. Adverse childhood experiences is
We'd love to do a
unfortunately.
training on session one day. We'd love to present to you all. It's free, so reach out to us. I'll put my email address. We'd love to present on that.
Okay, on ACEs, that sounds awesome.
Thank you.
Patricia, I don't know if Judge Diaz is back or not. I saw
She
her.
is, she is.
Okay.
She is.
So I don't think you had concluded, or had you, Judge?
Yes, I was just sharing my cell, and so I added it in the chat. Thank you, Martha.
Okay. Judge.
Okay, do we have any more questions or comments on the accomplishments of the Collaborative Commission? I should say that domestic violence is an insidious phenomenon that happens all over the world in all of the communities. And so while we continue steadfastly moving towards our goal fulfillment and developing others as we learn, we should also exercise patience, understanding what domestic violence is, understanding issues related to generational violence, related to the perpetrators and abusers, the dynamics of domestic violence, the idiosyncrasies of the community, and the places where domestic violence lives and exists. So all of that calls for patience and understanding that this is an incredible effort that the Collaborative Commission is leading in our community. So we cannot be any more appreciative of all of the stakeholders that participate to make sure that there is intercommunication and that everybody understands that there is a role that we all need to play when it comes to domestic violence. So for that, we are extremely gratified. So just wanted to put that out there.
Where did you say the ACEs training is? Sorry.
It's in the chat. You can find the
at the-
information in the chat.
It's on our www.institutetic.com. That's the Institute for Trauma Informed Care at University Health. We have free classes every month. Our calendar is available. You just hit the link and register. And then also in May, we have over 38 events virtual. If you would like to present, please reach out to me and we can include you all. I know Patricia, we need to talk, so you can, we would love for you to present. So please reach out. They are all free at this time.
Excellent. Hi, George. Thank you for joining us. We haven't seen you in so long. Are you muted?
Yes, I muted. I was double booked. I had two conferences at the same time, and I couldn't get off the other one fast enough. But I'm sure Andrew did a great job, and our staff is on the phone. I see Rosemary's on the phone, and so we're excited to be part of this. And I've worked with so many of you all, and the comments are right. Domestic violence is a serious matter, and I can say one of the leading causes of really one of those social determinants that really keeps the community from growing, and unless it's resolved efficiently. So,
absolutely. Thank you for that affirmation, George. Really appreciate that.
Yeah, absolutely. My mom raised me.
She raised you right.
She raised me right.
Okay, you guys, thank you for everything. Appreciate everybody being here. We'll see you guys.
Thank you, everybody. Take care.
Thank you.
Yes.
Thank you. Bye, Julia. Bye, Patricia. Bye.
Adios.